start the recording. Okay, so welcome to ABC Keystone's virtual training webinar related to COVID-19. So today, what I'm hoping to get across to everyone is giving you some guidance as a company that you may have your employees working currently, or maybe as we move through this, you will have your employees coming back to work. So what I want to make sure that I try to do is try to give you some information that incorporates what OSHA is looking at, what the CDC has provided us, and then also our state and federal government direction or guidance as it relates to COVID-19 and what we are to be doing. I'll mention a couple of the other states too, because there's some other good things available that they've done in order to address not specifically COVID-19, but just any kind of viral outbreaks or pandemic type things that we can use as part of our own procedures as we work through this. So my contact information is listed right here. You can email me your questions, or like I discussed there earlier, use the chat function on the GoToMeeting site here to ask your questions as we move through. Feel free to give me a call on my cell phone. That number is provided there on that slide also. I will put this slide up at the end for you to see. And again, if you have questions, please, any way that you want to reach out, I'm here to help you out. Like I had mentioned there earlier, I will be discussing a couple different documents. If you're interested in getting those from me, I'll happily share those with you. So when we look at this, we have to kind of start from, hey, you know, a pandemic. How often have we dealt with this, and kind of look at the history of this? And so we know that with this COVID-19, it started in 2019, and that's why the 19 is in it. And it's been kicking around since the end of the year. But if we look at the history of flu and viruses, the one that has gotten a lot of publicity or talked a lot about is the Spanish flu, the 1918 flu. And what was significant about that event was that it was an H1N1 flu, and it quickly spread around the world. And what was significant about it was 1/3 of the world's population was wiped out as a result of this virus. So when we look at this and we hear about flu and viruses and all those things, we know that they can have a significant impact on our world's population. So one of the things that we try to focus on is, hey, we have to make sure that we communicate this and share information quickly in order to address this and minimize the damage that this virus can have, or this pandemic. As we go through that timeline, then, I'm not going to talk a lot about each one of those, but there was an H2N2 in 1957. And again, this is one that started in East Asia in the spring and then quickly spread all around the globe and killed about 1.1 million people worldwide and another 116,000 when we specifically look at the US population. So when we look at 1968, we see the H3N2. And again, this is one that started in the US in the fall and then quickly went worldwide and wiped out about a million people and then 100,000 in the US. And then we get to 2009 and another H1N1 flu virus that was first detected in the US, and it quickly went around the world. And the big difference when we look at 1918 through 1968 is the way that we can communicate this information. So in 2009, we had this global network called the internet, and we were able to get information out quickly, which then really greatly reduces the amount of deaths that we can experience as a result of that. And then we come to 2019, and as you know, our numbers are running, about 1.9 million people that have had it, and worldwide, the number of deaths change each day. So again, you know, when we look at the total deaths, we say, well, every year, 60,000 people die from the flu. Well, what's significant about that is that, yes, 60,000 people die from the flu, but we have a vaccination, and the flu's been around for about 500 years. It's something that we know, it's something that we understand, and we still lose 60,000 people. When we talk about a new type of flu or a new type of virus, what we get concerned with is we have no vaccination, we don't know anything about it, and we don't know how to treat it. So we have to learn on the fly, and those numbers can quickly escalate and spin out of control if we don't manage it wisely. So that's the big concern. And that's kind of what we're seeing online and Facebook, is that now we have these doubters that are posting things that are saying, this isn't a big deal, it's less than the flu. Well, that's good. That means that we've gotten the communication out worldwide. We're taking actions in order to prevent it from spreading and worsening. So we know that we're communicating and we're seeing these numbers being kept low. There are other events also that are in there that are at least worthwhile talking about. In 2014 in the US, we had an outbreak of Ebola. And what had happened there was we had some doctors that were treating people in Africa with Ebola, and then they came back to the US, and this was not considered a pandemic. But what we were concerned about was we know a lot about Ebola, and we did not want that to spread throughout the rest of the US and become a bigger issue. So there were things that were done and discussed at that time in order to minimize the impact of Ebola. We also had SARS, a different type of COVID. We also had MERS as part of this. And those were not true pandemics. They were newer types of viruses that were around that we quickly jumped on and were able to manage it. So they were not a global event, but much more localized. So again, we've seen different things throughout the history. We know that these types of things are going to reoccur. We know the concerns of them are that history teaches us that we can have a lot of lives lost if we can't manage it well enough. So that is the big concern when we have these types of events. This was a saying or a quote from John F. Kennedy that I thought that was very appropriate for what we're kind of seeing now and going through. The time to repair the roof is when the sun is shining, right? So when it's sunny out, that's the best time, not when we have weather like today where it's raining heavily and we're getting all this water intrusion. Now we're trying to fix the roof. And what we're kind of seeing now when we talk about the response to coronavirus is this exactly. We're getting a lot of mixed messages. Messages are changing, it seems like hourly or daily as part of this process. And that's because we haven't really prepared for this type of event. We know that they've happened in the past. We've talked about doing different things, but we never really got fully invested in it. So when we look at this, one of the things that I saw and that was talked a lot about was in 2005, George W. Bush talked about the U.S., our unpreparedness to handle a true pandemic. And he started to sound the alarms and sound the whistles on this and saying, hey, look, we really need to prepare for this because we are not prepared as a country. And because of the global economy that we have now, this could have a major impact on us. So he started sounding the alarms, and it was ironically after he read a book about the Spanish flu, the 1918 flu, that he said, wow, if I look at this could happen every 100 years. We need to prepare for this because we're getting close to that 100-year mark that we need to get ready for this. So we know that was discussed then. And in 2014, it was discussed again when we talk about Ebola. So under the previous administration, what they said was, hey, you know what? We are not ready for this. We really need to get prepared for something like this. And they actually challenged OSHA to put something together at the time. OSHA actually worked on it and had a standard prepared for a response for a pandemic event. And we're looking to push forward on that. And that was moving ahead. And in 2015, there were documents that were created, and it was looking like this was going to be a new infectious disease standard that was going to be posted and put out there by OSHA. Well, just like in any new administration, Focuses change. They don't have necessarily the same type of agenda that other administrations might have. And that work that was put in place after the Ebola outbreak, or the dealing with the Ebola outbreak in the US, was put on the back burner. It was removed from the standard and it wasn't being pushed forward anymore. And they actually put it on their agenda to be looked at over the next 12-month period. So it was just kind of put on this long-term kind of thing that they were going to work on eventually. They just had different focuses. Now, I'm not saying that that was bad. I'm not saying that it was good. All that I'm saying is that this has been discussed for a long time, and that in our country, whenever we get a change in administration, the focuses change and things just get pushed or changed as we go through that process. So we know that when we talk about an event like this with COVID-19, that we've had the warning signs. Not only was it the CDC that was talking about this and OSHA, we know that there were other entities that were talking about this, national security and those kinds of things that were bringing up this, hey, we really need to prepare for a pandemic because we really sorely are lacking in our preparedness for this. So it was a focus for a number of years. So when we look at this and we say, all right, if we're going to put something together now, we really need to look at, well, how does this work? How does an infectious disease get transmitted to other people? Well, there's a basic chain of events that happens. There are 6 basic steps to the chain of infection. So when we look at this, we have to have some type of germ that's available, right? There has to be something out there. That germ could be a bacteria, it could be a virus, and it could be a parasite. And when we look at those 3, we know that we have antibacterial type things to address a bacteria. And what we're still trying to get our hands and our brains wrapped around is an antiviral type treatment, which becomes a bit more difficult. So we know that these are the areas that we need to be concerned with as far as the germ or the agent itself. So then once we know that we have this type of germ, we now need to look at, well, where do these germs live? Where do we have this reservoir where these germs might exist? Well, we know it can be in people. We know that it can be transferred in some cases from animals or pets. So our dogs or cats, we know that we can get things from those animals just from our exposures. We know that wild animals might be carrying that, if you can think of like rabies or those kinds of things. We know that we could have a food borne illness, and we could get something from the dirt, like our tetanus, those kinds of things. And we can have a waterborne type agent that could be an area where these germs will be thriving or living. Now, how do those germs then get transmitted to the next person? So that's that portal of exit. How do we get it? So we typically look at, we know that we can get it through the mouth, through vomiting or saliva, right? As we get this type of material out, it can be transferred that way. A cut in our skin, right, with our blood. So our bloodborne diseases. And then we know that any type of cleanup after your feces and those kinds of things, that we can transmit these diseases. So we now have to be aware of those kinds of events. Then once the germs are out there, we have them exiting outside of our bodies. Now we need to see how it's then transmitted to the next person, the mode of entry kind of thing. So we know that we can get it contact in with our hands, right? Anything that we touch. We also want to look at those areas of concern, which would be once we touch it, our T zone, the letter T, like Mr. T, our T zone. And what makes up the T are our eyes, nose, and mouth. Anytime that we come in contact with our hands, and now we come close to those areas, we now have an entry point for where those viruses or bacteria or parasites can enter our system. And now what we've talked a lot and learned a lot about with this COVID-19 is that we also have these droplets. Anytime that we cough or sneeze, those droplets get expelled, which we know about. Every flu season this is talked about. But what we're also learning that with COVID-19, even with breathing or just talking, we know that we can get these droplets that become airborne. Now, what we know is our safe zone currently is that 6-foot distance. There is a study that was put out by MIT that said these things can travel as far as 27 feet. So when we talk about 27 feet versus 6 feet, we say, all right, let's get a happy medium here. What is the safe zone before we cross over into this area of where we get into concern, and what we've landed on is this 6-foot zone. So we know that they travel farther. We don't want to get any closer than the 6 feet. So then how does it get in? We talked about the T zone, or eyes, nose, and mouth. Anytime that we get it in our hands, we come in contact with it, we can get it into those areas, and then it enters our body. Then the next part of this is then who the susceptible host. Each person then, how they respond to this is going to be a little bit different, right? So we know that children and babies are going to respond differently than an adult. We know that our elderly are going to respond differently than our middle age or younger population. And all of that depends on our immune system and how our bodies age, or what point are we in our lifespan. So when we look at COVID-19, we talked a lot about it early on, where we said, hey, look, our elderly population seem to be highly susceptible to this. Well, no kidding. That shouldn't be anything shocking to us, because it's the same population when we talk about the flu, that they're highly susceptible to it, because as we age, our immune systems start to just break down. They're not as effective. We also know that the rest of our body starts to break down. So we have a bit more of a challenge in order to fend off these types of illnesses. We also know, with depending on the type of bacteria or virus, it can also impact younger people. So our babies, our infants, our children. But when we look at COVID-19, what's kind of different with this is that we still have fatalities in this age group, but we're seeing them respond a bit quicker. And what we've learned from this is probably because of how COVID-19 affects our body and how it impacts us. What it does is it really has a strong impact on our upper respiratory system. So we know that once we breathe it in, it gets into our lungs, and we can develop pneumonia. And what's unique about this is that we can get pneumonia in both lungs. This is why we have this extreme difficulty with breathing. And we also see that it has an impact on our heart. So how we then circulate our oxygen becomes deprived as part of this illness. So again, we look at the type of host that we have. It's going to vary from each person to person, and it can vary based on their age. This is a standard chain of events that occur when we talk about how an infection impacts us. So when we look at the next slide here, and we step back and we say, well, that's great, Kevin. What about when we talk about in the workplace? Well, if we compare what we just talked about with the flu and influenza, and now we say, let's apply what OSHA tells us. Well, OSHA really deals with hazardous type materials, right? So when we look at hazardous materials, you're going to see a pattern here that really does kind of line up with what we talked about with the viruses and bacteria. So we know that we can get the route of entry with a hazardous material can be through our skin and through our eyes. And basically what happens is it's absorbed through those barriers. The membrane and the fluid in our eyes, we can absorb it. We know that some types of chemicals can be absorbed directly through our skin barrier, right? So we know that that is a common theme. Inhalation, anytime that we breathe in these types of things, hazardous materials in the workplace, they then have an entry point into our lungs. We can also eat it, ingesting it. So again, we're looking at our contact and then failing to wash our hands before we eat, or smoke, or chew gum, or chew tobacco. Any of those types of things can get these materials into our body. And then the last one there is injecting it. Just like any kind of drug that you can think of, if you inject it, a needle or those types of things, it can be put into our body. Also think about things like malaria, or any mosquito or tick transmitted type disease. This really kind of lines up with that when we talk about hazardous materials. So if we talk about COVID-19 and we say, all right, it's a hazardous material, if we just say it's like OSHA, we talked about our T zone, our eyes, nose, and mouth, that we want to keep our contact from our hands away from those areas. So we know that we need to protect those areas as part of the process. Now we're adding the rest of this. We talked about, hey, we don't want to breathe in those little droplets. So in order to protect the worker, we can have these face masks, right? And these face masks that have gotten a lot of discussion are N95s, which I'll talk more about. And now what we've gotten to is we can make our own. And it's really, if we want to think about this, what we're doing when we make our own, or we use a surgical mask or any of these other coverings, a scarf or whatever it might be, it's not that we're protecting ourselves, the wearer of that mask. We're protecting everyone else around us, so that we're trying to capture those droplets that we're spitting out or coughing out or sneezing out or breathing out as part of the process. So that barrier is to protect everyone else, not the wearer or the user. And if you can think about this, and this has been around when we go into the family doctor and we get into their waiting area in their lobby, they'll tell you, they'll have a sign there, if you're coughing or sneezing or you have symptoms, please wear this mask. And again, the intent there is to protect everyone else in the waiting room. We'll talk more about ingesting it as part of the process as we move through this. So when we look at the next slide, what I'm trying to show you here is just that same kind of concept of ingesting and breathing in and all those, inhaling, all that stuff is how these different types of viruses and bacteria get into our system. So if we follow around from the top there, a person's coughing or sneezing or breathing out these droplets, and then it gets into our system, it now gets into us, and now it has this route of entry. A foodborne or waterborne illness can be part of the process of ingesting it. We could have a cut, a blister, or a sore that becomes open, and now that infection can settle in there, or we can get a cut from a knife or some other sharp object. And again, we're just talking about the mosquito-borne or tick-borne illnesses as part of that injection type thing, or a dog bite. Any type of puncture into our skin can introduce it. Now, when we look at other types of illnesses as part of this, we know that there are sexually transmitted diseases. COVID-19 isn't necessarily a sexually transmitted disease, but we know that we can get these droplets from breathing that would be part of that system. So again, now that we know the routes of entry, now we want to try to protect the worker as part of that process, or anybody when we're trying to protect anyone. So when we look at this, we know that it's a person-to-person transmittal of the illness. So we have that 6-foot distance, social distancing as part of this. We know that we want to protect people. So, initially we talked about, hey, we need to wear these N95 respirators. And if I can pause right there to talk a bit more about N95 respirators. When we talk about an N95 respirator, an N95 respirator protects the wearer. So the user of the N95 respirator mask, it's protecting them. This is why this mask is being talked a lot about in the medical field. The other thing that we need to back up, and anyone that has worked in safety, we know that we have different types of masks. We have an R, we have a P, and we have an N, right? And those are all based on the type of oils that it's protecting us from. Then those numbers then tell us the percentage of what it's going to block is based on the size of that microorganism or whatever that hazard is. So an N95 is a non-oily or non-oil protection respirator that protects you from 95% of 0.03 micrograms of material. So if we have an N99 or an N100, what that talks about is the same kind of oil-based type protection. It's a non-oil-based type protection, but it'll protect you at 99% or almost 100%, close enough to be considered 100%. So when we move through this, everyone talked about, hey, maybe an N95 isn't good enough. Maybe we need to go to an N99 or an N100. So we know that we were still trying to problem solve with this as part of protecting our medical staff. The other thing that you need to remember, if you're giving your workers an N95 respirator to wear as part of this face covering, and they have the illness and they are a carrier and they are asymptomatic, they're not showing those symptoms, an N95 respirator, if it has that little cartridge in the middle of that mask, it has a little flap there. And what we've learned as part of this process and discussing this is, hey, it's protecting the user. So anytime they breathe in, the flap then filters that air through the mask. But when they breathe out, the flap opens up and allows those droplets to escape. So if the person actually has COVID-19 and is wearing an N95 respirator, they are still going to allow their droplets to get outside of their system and land on other materials. So it's not something that we want to be wearing to protect others around us. So we know that as these droplets get outside of our body, they can land on different surfaces. So we've talked a lot about this, of cleaning those surfaces. And what they've talked a lot about was, hey, look, you can use home household cleaning agents to clean this up. It's kind of a sensitive type virus. We don't necessarily have to jump to the wipes and those kinds of things, but that's kind of the practice that we're following. Now those all have become difficult to get. So now what we can use is a bleach and water type solution that you can mix it up and spray it down and then wipe the surfaces clean. And you should be doing that on a higher frequency level than what you normally would. So OSHA has looked at this, and again, they blew the dust and all those things off of their work that they did in 2014 and 2015. And they rolled out this document that was specific to COVID-19, and it was giving us guidance on preparing our workplace for COVID-19. This document's now a little bit over a month old. It's OSHA 3990 is the document, and they made it available on site on the OSHA.gov site. And it really is a pretty solid document. You know, a lot of the stuff that OSHA puts out is not even worth the paper that it's printed on, but this is actually a pretty good document. It's still holding up, you know, more than a month out from the exposure to this, even though we've learned some things. It gives us some really good guidance on what an employer can do to protect its workers from this exposure. Now, as we have moved through this, we've learned some other things as part of this. This is not a standard. This isn't something that you would be written up for. But that doesn't mean that OSHA can't do any corrective actions against the employer that exposes their worker to any type of coronavirus type exposures. So what we look at is, well, what does that mean? Well, when we look at this, we know that the OSHA has the general duty clause, right? The general duty clause states that every worker has the right to go to a place of employment that is free from recognized hazards or illnesses, and that the employer has the responsibility to protect the worker from those hazards and illnesses. So when we look at that and we look at the wording of that, illness kind of stands out at us. Now, OSHA has said, hey, the flu and colds and those kinds of things, that we're not worried about that. But when we talk about coronavirus, OSHA's saying, yes, coronavirus, if they contract this illness in the workplace, this is a record-keeping type event that you are to record it on your OSHA log. Now, in there is the catch, right? How am I going to prove that I got it in the workplace? Well, that is the catch. We don't know where you may have gotten it, other than what are your work practices that you have implemented in the workplace to prevent the spread of this illness? So the general duty clause is the master card that OSHA can play if we see a sudden outbreak in a workplace. And one of the ones that I saw last week was, I don't know if you saw it in the news, Pepperidge Farms up in Denver, they had 5 employees that came down with coronavirus. Now, they hadn't worked in the facility in a week, but there were 5 employees in one facility. That may trigger some kind of event where someone might go in and look at, hey, what safe work practices did you have in place here, and how are you preventing this spread of the illness? The other thing that we can look at that OSHA may rely on to address this type of issue would be just their general personal protective equipment. What have you done to protect your workers? So when we look at our personal protective equipment, the basic thing that we do is we know, hey, you have to do a hazard assessment in the workplace. We have to identify what those hazards are, and then we have to come up with this plan to protect the workers. And part of that plan typically is personal protective equipment. We can also look at what they have for eye and face protection. Another one that's going to be weighing heavily in on this is our respiratory protection plans. So some information was gotten out directly geared towards the medical field. And what they talked about, what OSHA talked about was, hey, medical providers, we're going to waive this as we work through this, that you don't have to do that fit testing, that annual fit testing for your workers for these N95 respirators. Now, everyone kind of jumped on board and said, oh, that's great. We don't have to do fit testing. No, that's not what they said. They said that the medical field does not have to do annual fit testing as we work through this. But what the medical worker had to have was a record of the initial fit test. And they had to then give them this exemption for, hey, you don't have to do that on an annual basis, but we must see the result of a previous fit test that was completed. So when we look at what about everyone else, all the other industries, well, OSHA has just put something else out for an interim directive on how you can violate this policy, or it gives them more guidance to their field people. And basically what they said was, hey, as we know, we're working through this, N95 respirators have gotten very difficult to get. We can't get these things anymore. So they then put together this interim directive that says, look, other countries have things like NIOSH that look at our respirators and evaluate their protection values. And so what they did was they laid out a list of these different countries like Australia and Brazil and China and said, look, here are the standards that they have to meet for those countries. If you can't get an N95 respirator, we will allow you to substitute that N95 respirator with these other very specific country types that meet these standards. Now, what goes hand in hand with that as part of the respiratory protection plan is you still have to do some training on it. Okay, we get a KN95 respirator that meets the requirement that was made in China, right? We get these. Now I have to train and show my worker all of the same thing. Well, this isn't an N95 respirator. This one's a little different. This is how you put it on. This is how you take it off, and all those other things that go along with our respiratory protection training. You also have to then do an initial fit test. You're not exempt from doing fit testing. You must do an initial fit test for any of these substitute type respirators as part of this process. So again, you have to have your ducks in order when we talk about this. I think that the more concerning thing when we look at respiratory protection is, let's say our silica, right? So now we have a silica exposure, and we previously, pre-COVID-19, we had N95 respirators that we're using because we followed table 1 of the silica standard. And then what we said was, okay, we have these N95 respirators, they're in APF 10, here you go, we train you, fit test you, all those things, here you go guys, here's what you're gonna wear. Now that we have these shortages on these, that doesn't mean you get out of jail free for being exposed to silica. You must still protect the worker from the silica exposure by protecting them with the appropriate respiratory protection. If I can't get an N95, now I'm going to try to get a PAPR, a powered air purifying respirator, or something else, an elastomeric type, or a full face, any of these other types of respirators that I can put them in, but I must do all the rest. I have to then show that I've showed you how to put it on and take it off and take care of it and fit test and seal checks, all those other things that go along with this. So when we look at respiratory protection, we're really specifically looking at in the workplace, we may have another safe work practice that's put in place, is just these coverings, these face coverings to not capture these droplets. That is not part of the respiratory protection plan. That is just following what the guidelines are in preventing the spread of COVID-19. Those are not respirators. Those are for something else. So I still have to now separate what is for respirators, what is not a respirator in my safe working practices. Other things, though, if we whip through this, hand protection, so I may implement a glove program, sanitation, how are we going to clean? How am I going to protect the people that do the sanitizing? Bloodborne pathogen type things we may have to button up. Hazard communication, so as we move through this, we can't use these wipes, we can't get them. So now we're mixing bleach and water. I still have to have hazard communication around that and make sure that my workers are mixing it safely and know when to mix it. And then I may have other types of things as far as labeling that might weigh in on this. So maybe we're using some other type of cleaning agent that we have to label. So again, we need to make sure that we're looking at all of these other OSHA type policies to make sure that we're buttoning up to address whatever we're doing or whatever we've added in order to create these safe work practices. One of the other things that you may run into is medical access. Medical access under OSHA, I have to provide any worker that wants records of their own medical findings, that I provide those to them. So I need to make sure that I'm looking at all those ins and outs as part of this. So again, if we look at our record keeping, if you suspect that there was an outbreak in the workplace or on your work site, and now multiple people have this coronavirus, I must record it on my OSHA log, and then I have to then break it down for, hey, they got inpatient hospitalization. There was a fatality as a result. All of those things end up on my OSHA log as part of this process. So again, there's some things that you have to work through as part of this to make sure that you're buttoning everything up as part of your protection of the worker. So now we look at this and we say, oh my gosh, where the heck are we going to start? Well, basically what OSHA's guidance says is that we have this plan that we're going to work through. Again, it's not sunny and bright and we're fixing our roof. It's raining. So now we have to work through this pretty quickly. So one of the first places that you need to start is really reviewing your HR policies. Take a look at these. You want to look at what do you have in place for HIPAA. So when we talk about HIPAA violations and we say, hey, Joe Smith just got coronavirus on this work site. And now I start running around my job site saying, who worked with Joe Smith? Joe Smith has COVID-19. Yeah, he's in bad shape. No, that is a HIPAA violation. I must protect Joe Smith's personal information as part of this process, but I must also find out who else he exposed or had worked with as part of what I need to do to investigate this. We also may run into ADA compliance issues. So we've talked about this. COVID-19 seems to be hitting harder our older populations. So you might mean well where you say, you know what, we have some individuals, they're in their 60s. I know that they have asthma and they have the beginnings of COPD or whatever it might be. Why don't we put them on layoff? Because we want to make sure that we're protecting them. Well, when you do that, you need to make sure that you are looking at this in the right type of lens. So the protected age group is anyone 40 years of age and older. And as soon as you start selecting your older workers and you're saying we're going to put them on layoff because we're trying to protect them, you're opening yourself up for an ADA lawsuit. Someone in that group is going to say, hey, look, they age discriminated against me and now I'm going to sue them. So you need to button up your ADA compliance as part of this. You're going to want to look at your absenteeism policy. And it's not just as easy as, hey, our guys are out, and, you know, all those kinds of things. But now we want to plan for, hey, when we come back to work, we know that it's not going to be a light switch that everyone, okay, back to work, everyone's back on the job site happy and we're ready to go and all those things. No, we may be rolling this back in, and part of this may be discussions with certain workers who say that they're fearful, that they don't want to come back. They're afraid that they're going to get coronavirus, or that you know that you've had some workers that have had it. So now you have to look at your absenteeism policy and say, hey, look, we have to look at this realistically, and we have to have some empathy as part of this, and we need to address this, how we're going to do this within our company. So with those types of things, you may want to have your legal team or your legal advisor reviews part of that. We know that there might be some work refusal due to safety concerns. This is where we know that we have this outbreak, so we'll use Pepperidge Farms as part of our example. 5 workers have it, and now they know that they've worked with these people, and the word kind of gets out there. We know that, hey, you know, so-and-so is out because of coronavirus, and now they may refuse to go to work because they feel like you're not cleaning well enough, you're not sanitizing, you're not protecting the worker. So how that has to play out is you want to make sure you're doing and sharing this information, communicating it clearly with all your workers, what you're doing to protect them. And then also being open to any other types of discussions around that. So you may want to look at, if someone comes to you with a concern, investigate it, follow up on it, and then put it to bed, put it to rest, address it, and then make sure that they know that you've addressed it and what you've done. Because what can quickly happen is if they don't see anything or hear anything after they have advised you on that, they can then ramp that up. They can then report you to OSHA. And if things are still not being done, they can now say, look, I have a safety concern here and you guys aren't listening to me. I'm going to refuse that work. And really, that is their right as the worker. You may also want to look at your fitness for duty. So your fitness for duty is really going to be specific to, we've gotten some guidance from CDC where they're saying, hey, look, if people are sick, don't require them to have a doctor's note. But what you want to look at also as part of that is, hey, we know that someone was sick with this. How do we get them to come back to work? So now we want to have a doctor's note that says, hey, look, they're fit for duty to come back to work. We want to make sure that they're okay, they're recovered, and we do want some kind of medical guidance on that. We also want to look at our drug policy, drug testing policy, because when we look at our drug testing policy, what we're looking at, let's say we have some DOT drivers, or we follow the DOT as far as our guidance for our drug testing. One of the things that can come up is we do a random drug test. I go to my driver and I say, hey, look, you've been selected for your random drug test. You have to go over to the clinic and give them a drug screen. And what they'll come back to you and say is, well, wait a minute. I know that they've been dealing with coronavirus over there. I'm not going over there because that's going to expose me to coronavirus. What the DOT has said is, that's a valid point. So you as the employer need to look at, can I get these clinicians to come to me to collect this sample? Can they come out on site? I need to document all my attempts of what I'm trying to do in order to set up this randomized testing. If they're still refusing, now what we've had in place, and again, you want to talk to your legal team, is that a refusal is a positive, right? Well, we want to look at the other parts of the DOT, which is that they said, hey, you can remove them from safety sensitive work until they give you the drug screen test, until they give you the sample. So again, you want to talk through that with your legal advisors to figure out how you want to address any refusal to go to a clinic to do sampling. So on the HR side, you have a lot of heavy lifting to do in order to prepare for working through this and to prepare for when we start to return back to work after the event. When we start to look at the safety side of this now, and moving on to the second item here, we want to really review our job safety analysis, job hazard analysis as part of this, and we want to add COVID-19 as part of our restrictions or part of our hazards that we need to address. So I really need to rely heavily on both our state and federal guidelines of what we're supposed to be doing with this. So again, we've seen the whole gamut of all of this stuff. One of the things that has just gotten out there is that the CDC has given some additional guidelines for people that are critical to the infrastructure as far as the type of essential worker. And what they talk about is if a person has been exposed to COVID-19, allowing them to continue to work if they are asymptomatic. What do you have to do? And what they talk about is daily. You have to do temperature readings. You have to monitor that person. They must wear a face mask, a face covering, and on and on. They give you additional guidance on that. Any symptoms that become apparent or any changes in their condition, then you must have a plan in place on how to remove them from the workplace. So you as an employer have to take a look at this as how do we want to handle this? Do we want to follow that guideline, which is really more for the high risk type worker versus something that's a little more watered down. It's not as extreme. But you want to take a look at that as far as your work safe practices. The next thing, we want to look at very site-specific, task-specific types of reviews. What do we do in a multi-employer job site? How are we going to check on these workers daily? Where are we going to have an isolation area if anyone that becomes symptomatic or has some of the signs and symptoms of coronavirus? How are we going to deal with someone that's asymptomatic but they were exposed to someone? How are we going to approach our enclosed work environments versus our outdoor environments? And when we look at both of those, we know that there's a difference between those. There's going to be a different type of safe work practice in an enclosed environment versus an outdoor one. And we'll talk a little bit more about that later. And then the last thing that OSHA gives us is that we want to identify different kind of risk levels with our workers. And they lay out the basic definitions of each one of those levels. So how does this impact our workplace? We talked about a couple of these. I'm not going to spend a lot of time on it. We know absenteeism is going to play a big role in this. We know that it's going to be a change in the patterns of our commerce. We saw this as part of the tariffs, right, before we even had COVID-19. And what we were starting to see was, based on these tariffs, we were starting to see some supply chain disruptions, right? Then once coronavirus hit, we saw even more of this. So depending on where you're getting your tile, which it comes out of Italy a lot. So when all of these people became sick, they were not shipping this stuff. So we had this supply chain interruption. So we know that there are different patterns of this process, and we need to address that as part of our moving forward, right? How are we going to identify these areas? Where are we seeing the impact? And then we also want to have some kind of check-in procedure of when we receive these goods. Do we want to sanitize them somehow? And how do I keep my workers safe? So there's a change in our processes that we need to share with all of our workers. We talked about HIPAA. We know that this has a direct impact on that. We also need to be aware of FMLA. The Family First Coronavirus Response Act was enacted. As an employer with 50 or more employees, there's a poster that you must post in the workplace and make it available to all of your workers. And basically what it says is, if I have any employees or workers that were impacted by the coronavirus where they had it, you must pay them 80 hours of pay as part of that process, and it then follows FMLA rules as part of their policy. So you want to go back and review that and make sure that you're following all those guidelines. We talked about DOT and drug testing and what we need to do. And now we really want to look at when we look at our job site and our workplace, we want to apply the same rules and policies that OSHA has in place for our workplace in creating a safe environment. So that means that I have to implement a marriage of these different types of things. We talk about face masks, social distancing. Are there any additional PPE guidelines that we need to follow in order to protect my worker from this coronavirus? So anyone that has gone through any of my other trainings, what I always say is OSHA is basically 4 steps. No matter what we look at, this is what OSHA asks you to do. They ask you to identify and recognize what the hazard is, right? And in this case, we'll say it's coronavirus. I need to create and document a plan. So I got to create this written plan to address the hazard and how I'm going to protect my workers. So we're going to have in our written plan social distancing. They must maintain 6-foot distance. We're going to look at where they're eating. They can't eat in the same place. They must be separated. We also want to look at how are they transported to the job site. How are they getting there? Oh, they get in a company vehicle. They take a company truck and we send all our crew out there. No, that's not social distancing. So now you got to look at, well, how am I transporting these? Oh, these guys are going to drive themselves. Oh, well, now that opens up other avenues. What am I going to reimburse them for mileage? How are we going to do that? So those are other parts of your plan that you need to address. I then need to share all that information with my workers. I need to train them on what we're doing and these safe work practices that we're implementing. And then I have to assign someone to monitor this. I have to police this. I have to make sure that if my written document says that my workers are not going to be within 6 feet of each other, but if they are, then they must have a face mask, all those other things. I have to make sure that we're doing that. Otherwise, we're not following our written plan, and OSHA is going to say, hey, look, you're in violation of your own rules here, your own plan. And that's one of the things that we saw with silica. The number one most cited as part of the silica rollout was people had a written plan. They said they followed table 1, but in actuality, they were doing the same old thing that they were always doing, and OSHA was writing them up for you're not following your own plan. So those are the basic 4 steps. We also know that no matter what the hazard is, we want to implement hierarchy of controls. This is the glorified one where we have elimination, substitution, engineering, administrative, behavior type things. When we talk about NFPA 70E, we talk more about behavior than anything else, and then PPE. And when we look at coronavirus, we're really going to hone in and focus on engineering, administrative, and personal protective equipment as part of protecting our workers. As we move down, it becomes less and less effective. So engineering would be the best, administrative controls would be next, and then our PPE. So where do we start when we look at this? We just have to identify the areas that we've talked about. Where am I going to get my workers congregating? It's a multi-employer job site. I may want to look at the co-workers. How many workers are going to be involved in this task? What are we going to do to protect them? I need to look at, do I have customers coming on this job site where they're making deliveries, or there's other people that have to come out there? How am I going to protect those workers, and how am I going to isolate them from being on the full job site? I want to also weigh the risks of my worker's age. Again, we talked about ADA, but I got to be aware of that. And I may want to look at, well, maybe I'm going to partner them up or do something administratively to protect that worker the best that I can. I need to look at underlying health conditions as part of that and any compromised immune systems. But again, I need to be aware of ADA compliance. So then we move on to the next thing. We're going to look at addressing the rates of absenteeism, our policies, whatever we create for coronavirus, and then we're going to have these social distancing. I may have to then stagger my work shifts. And a real common practice I think that we're starting to see is staggering your break times. I don't want everyone to be on lunch at the same time where I have this large group of people. I also want to discourage and prevent workers jumping in their vehicles and they're having lunch together. I want to make sure that they're separated by at least 6 feet. Maybe I designate an area or something, but I need to be aware of that. I need to also provide hand washing stations. Maybe it's plumbed if you can do that. I can have water running for them, but then I have to provide soap. So soap and water is the best. If I don't have soap and water available, then I want to go to the hand sanitizer. I want to encourage them to wash their hands for 20 seconds. And by this point, everyone knows you can sing happy birthday twice, or you can sing the alphabet to wash your hands for 20 seconds. But again, it would be part of your procedures that you review with your workers. If it's hand sanitizer, you want to tell them to wash their hands with a hand sanitizer, keep wiping until their hands are dry. So again, we need to at least educate them on how we're going to do this. I may want to look at our toolbox meetings and things. How am I going to do that? Am I going to text information? Am I going to email? Am I going to make access to servers? Those kinds of things. I want to make sure that they understand they're supposed to stay home if they're sick. How does that reporting go? And what are the signs and symptoms? And again, I think everyone knows that at this point, what we're looking for. And then we want to make sure that we have cough etiquette implemented. Even if they have a mask on, encourage them to cough into their elbow or make tissues available to them. And if I'm making tissues available, I want to have no touch trash cans, meaning I step on a pedal and the lid comes up. I don't want to have to touch the trash can in order to throw things away. And I want to cover that trash can so that those materials don't get blown around on the job site. So again, I'm looking at containment as part of this. And if I can implement some kind of telecommuting or something from working from home, we can try those things. So when we look at isolating our sick worker, so when we look at this, and when I thought a lot about this, when there's something new or something I'm kind of curious about, what are others doing in order to address this? My pattern of thinking is, what are they doing on the West Coast? Let me take a look at the West Coast, and I'll go to OSHA's website. I'll go to the state of Washington's website, and I'll look at Oregon. Those three I found have been very helpful. They have some good programs out there, no matter what you think of OSHA and all the restrictions that they have. So when I went and I looked at those areas, one of the things that jumped out at me was the state of Washington quickly jumped on this, and they had a procedure for getting workers into the workplace. And what they did was they screened their workers with just a basic questionnaire. They asked them 5 or 6 questions and to see if they had any signs and symptoms, did they have a fever, any of those kinds of things. And it was just a checklist. And if any of those were yes, then they flagged them. Then they had an isolation area where they would send them to be addressed from there. California actually had something in place. They had the ATD, which is aerosol transmissible disease standard. And they were prepared for something like this. So they already have a bunch of documents of what you can do as far as a worker or as an employer to implement in order to protect your workplace. So there's some good documentation there in California that all you have to do is kind of tweak it to make it work and fit for COVID-19. But they have some good documentation. Oregon is the same. They have some very good documentation on their preparedness and what you can do as an employer. And basically, all three of them have this screening process. And what we're learning is the checking of the temperature is critical. You can either do that yourself, where you get the forehead scan, or you can trust your worker that they tested it. And what I would caution you on is that, yeah, I checked my temperature and I feel fine, and they haven't really checked it. So you may want to do some other things in order to do your screening. You want to designate a person to be part of that assessment process. So they need to be in an area where they're protected, and they do that screening, and then follow up on whatever the next procedures are in case they identify someone. Again, we want to educate the worker, and we want to designate isolation rooms in case someone goes from asymptomatic to symptomatic as far as these types of illnesses. So again, a quick review. We want to make sure that our workers are staying at home. We want to discourage any sharing of materials or equipment between employees. So if we look at before coronavirus, hey, check this video out on my phone on Facebook or whatever, and they share videos and they passing their phone around. You want to make sure that those kinds of practices are not being done. You also want to look at shared tools and equipment, that they're sanitizing in between the use, and implement that to protect the workers. Or just have a glove policy that your workers must wear gloves. And again, the glove is just a barrier, so it could be any type of glove as part of that process, but you want to make sure you do the assessment that the glove fits properly. We talked about a return to work. Not if they're sick, they don't need a doctor's note, because we don't want to overload the doctors. But if there's any kind of return to work where they're already getting treatment, then you want a doctor's note for that. And then you want to create some kind of flexibility for your workers in case they're caring for their children or any other sick family member, any of those types of things. Again, you're going to approach that with empathy. And then you want to make sure that you have these clearly established return to work policies that everyone understands. So again, it's very basic when we talk about this. We're going to use the hierarchy of controls when we're addressing the safety of our workers. And what we're going to look at is engineering controls, administrative controls, and our personal protective equipment. So when we talk about engineering controls, this is where you're going to look at that enclosed environment versus an outdoor environment. You're going to be able to manage this a whole lot better if it's an enclosed environment. I'm working inside of a building. I'm working in a building under construction where there's not a lot of wind, or there's not a lot of there's a lot of stagnant air, right? So we know that the stuff's going to hang there. So if I can look at the ventilation system. So if I'm looking at the ventilation system, I can put in high efficiency filters or HEPA filters. And I can increase the ventilation rates for that enclosed area. I also want to look at, is this a shared ventilation system where I have workers in different rooms? And if it is, gosh, I got to do something else, right? I want to make sure that I'm isolating this the best that I can. I can create a negative pressure room as part of the process if I need to, but I need to understand this a little bit better. The state of Minnesota has some good information on this type of thing, this type of engineering when we look at our ventilation. I have a couple documents on that. If you're interested in that, I can pass those along to you. But if you go to the state of Minnesota and do a quick search for ventilation rates and those kinds of things, you'll find this document that'll give you some assistance. Again, this is kind of unique. Engineering controls, that's about it. This is only really addressing those enclosed environments. We're really going to be relying heavily on our administrative controls and personal protective equipment. So what are our administrative controls? Well, with engineering controls, the employee doesn't do much. The worker doesn't have to do much. They just go in and they do their work, right? It's all controlled by whatever's going on around them. Administrative controls, now the employer, the boss, the management in the field, and the worker have a little bit more that they have to do. So I need to make sure that we're following the basic guidelines. If you're sick, stay home. And now I want to make sure that I'm rotating workers in order to maintain these lower numbers, less than 10 people congregating in one area. I want to now look at, hey, we got to hang a door or whatever it might be. How am I going to do that? They're going to get closer than 6 feet. What am I going to implement? Oh, well, they're going to have to wear these face coverings, and they're going to wear gloves or whatever. And I'm going to encourage more hand washing, right? I'm going to eliminate all that non-essential travel. And I'm going to establish some kind of transportation type thing. So again, we talked a little bit about that. Or social distancing would be part of this. I'm going to look at, hey, are there any food trucks that are showing up on these job sites? I got to stop that. Because on these food trucks, you're going to be touching these same surfaces and people are going to line up there. And we don't want that to happen. So we need to address that. or at least filter that out somehow. And then I need to make sure that we're providing the training that we need. We talked a little bit about staggering our lunch breaks and break times in order to limit the total number of people that are accessing each other. So the safe work practices really become a critical part of this, and we're going to document those things. And we talked about the no-touch trash cans, disinfectant wipes, how am I sanitizing these things. We talked about fecal matter, right? So I got to have more frequent cleaning of those job johnnies at porta potties that are out on the job site. What does that look like? And I got to coordinate that with these companies. If you guys are doing it, I don't know if anyone that does that on themselves. How am I protecting that sanitation worker? Who is the person that's going to go around and wipe down all the tools, the shared equipment? How does that flow? I also want to make sure that no one is eating food or drinking in the work areas. Remember, we talked about that T-zone. So I don't want them to be smoking. I don't want them to drink. I don't want them to eat. I don't want them to chew tobacco, and I don't want them to chew gum in the work site, in the work areas, because they have their bare skin coming up to that T-zone, which now introduces the infection. So you want to make sure that you want to designate these areas and times that they can do that, and you want to have hand washing facilities available to them as part of that. And we want to make sure that we're also looking at sanitation of other equipment. So I have fall protection harnesses. I share these things between workers. Okay, how are you sanitizing those to protect the worker? So if I'm going to protect my worker as part of that process, I may want to look at, hey, is it just going to be better for us to assign people equipment? I want to look at face shields, right? If I have a grinder or something where I have to use a face shield, typically we share those. Well, how am I going to sanitize that in between each worker? So I need to look at all of these different types of things and address it as we go. Then that leaves us with personal protective equipment. So we talk about the respirators, right, and the face coverings and the differences between those two. But we want to look at gloves, goggles possibly, face shields as part of this, and then our respiratory protection plan. We want to make sure that we're providing enough protection for our workers as part of the process. So if I make any changes with my respirators, I now have to do all the same things that I've done. Do they know how to use it? Do they know how to maintain it? Do they know how to clean it? Do they know how to store it? Do they know how to do the pressure checks if it's a sealing type respirator? All of those things become critical as part of this process. So with my personal protective equipment, I would want to have that connected to my job hazard analysis, right? Here are the hazards that I've identified. Here's how I'm going to protect that worker, and then personal protective equipment might be in that list as part of the process. The last thing that we're going to talk about then is our workers and classifying the workers. This is directly out of the OSHA 3990, the guideline on protecting the workplace from COVID-19. And what they talk about is there's very high, medium, and lower risk workers. So our very high and high exposure workers are really our medical people, our morgues, all of those people that are coming in direct contact with a sick person. So most of the people in our workplace are going to be the medium to lower risk category. So you want to make sure that you kind of follow OSHA's guidelines on medium to lower risk. So again, when we look at our very high risk and high risk, that's our healthcare provider, frontline workers. And then our medium risk would be our jobs where we have frequent and or close contact with other people that could be infected with COVID-19. So maybe in a school or a high population area, or we have customers that are coming in and out, those kinds of things. Our grocery workers, right? Any of the grocery store workers, they have this, they're more in that medium risk category. Our lower risk would be any other type of medical exposure where I can kind of keep them limited and keep the social distancing in place. So in protecting these medium risk workers, I want to go through all those processes, right? Can I put engineering controls in? What administrative controls am I going to have? And what personal protective equipment am I going to have as part of that process? We talked a lot about respirators. I don't need to review any of those kinds of things as part of that. So some of those guidelines that we've talked about: social distancing, stay home if you're sick, cover your cough, cough etiquette, wash your hands frequently, wash for at least 20 seconds with soap and water, or hand sanitizers as part of that. So again, I would post those kinds of signs inside of my porta potty, wherever restrooms are, that people are reminded. You're going to have these areas designated where you're going to be eating, so you're going to just have those posted there and all of those things. So someone has to monitor to make sure that you're doing that. And then the last thing here, this is that family first response to coronavirus document that we talked about. This is what you need to have posted in the workplace. And then you must pay your workers for 80 hours if they get coronavirus as part of this Family Medical Leave Act exception for coronavirus. So again, you want to make sure that you're researching that a bit and make it known to all of your employees as part of the process. So again, the questions, I'll pull this up now and see if anyone had asked some questions as part of this. And if there's anything else here, you can always shoot me an email if you have specific questions. All right, so one of the questions here is, how long can the virus stay alive on a surface? So we've seen this, right? We've talked a little bit, or we've seen it on the news as part of this. And what we've seen with this is that it varies depending on the type of material that the the virus has landed. The virus itself is not a living, breathing type thing. It's just a virus, right? So when these materials land on surfaces like plastics, metals, those kinds of things, we know that it can be viable for 3 days. It starts to lose its viability the longer it's on that surface. So, it depends on the individual that it comes in contact with and how they respond to this exposure. And that individual may have multiple exposures that finally end up being a bigger deal to how they process this. So we know that our metals and our plastics, our hard plastics, are an area of concern. What we're also told about is our papers and cardboards. It can survive on there or be a viable type thing, but you're less likely to contact or come in contact with this quick enough in order to get it introduced into your system. I know that we've gone this full gamut as far as our directives. If you go grocery shopping, at one point we were supposed to wipe down all of our groceries and designate the dirty area and the clean area when you do that. And I think now what they're saying is we don't have to be as strict with that right now. But again, this is the type of information that we get that changes from day to day and sometimes hour to hour. And we're starting to see that they're starting to get a better idea on this. So all that my advice would be that any of these surfaces, these harder surfaces that are not as porous, those would be the ones of concern that could have a viable virus on it for up to 3 days. So please feel free to send me an email, give me a call. I hope that you enjoyed this. It's a lot of information to cover, I know. And it's amazing, the amount that we learn in a short amount of time. When we look back on this, we had the exposure that really started to ramp up in the beginning of March. And here we are in the beginning of middle April, and we're starting to see the effects of all that. So hopefully we'll get through this soon. I thank you for joining us today. And I look forward to seeing you on some of these other webinars. And if, like I said, if you have any questions or would like some of those documents, just shoot me an email or give me a call. All right, with that, I will wrap this up. Enjoy the rest of your day. Stay safe. And I look forward to seeing you live and in person soon. All right, take care, everybody.